Good evening, everyone. A very warm welcome to our next session on Understanding the Silent Threat Liver Cancer Awareness, a nationwide campaign organized by Voice of Healthcare in collaboration with Isai Pharmaceuticals. I'm Dr. Muskan Ahlawat, representing Voice of Healthcare, and I will be leading today's discussion. It's very heartening to see so many of you joining in to learn more about and protect your health. So let's talk about one of our most vital organs, the liver. The liver is a powerhouse organ performing essential tasks like cleansing our blood, aiding digestion, regulates metabolism, as well as stores energy. Yet liver diseases, including liver cancer, often develop silently without clear warning signs. We often take for granted that liver works thoroughly and quietly, but it also helps in filtering toxins, supports digestion, and keep our energy levels up. So, unfortunately, liver problems can progress without noticeable symptoms, and making early awareness and screening very crucial. In today's session, it's all about understanding liver cancer, busting some myths, and empowering ourselves with the knowledge to protect this vital organ. We are very privileged to be joined by Dr. M.A. Raja, Director of Medical Oncology at MGM Cancer Institute, Chennai. Very welcome, sir.
Good evening.
Sir, to begin with our session, we would like to understand from you that liver diseases have becoming, a public health concern nowadays. So, what are the current trends that are happening in India about liver diseases or liver cancer?
Yeah, I have to say that I am not a general expert on liver diseases, but
Yeah.
liver cancer, I can answer your question. If you look at a ranking of liver cancer, yes, it is not in the top 10 cancers. However, the incidence of liver cancer is increasing in India, and the ratio is roughly sort of 5 to 1, meaning that for every woman affected by liver cancer, there will be 5 men affected by liver cancer. And we are particularly looking at the age group, say 40 to 65. This is the age where the highest incidence of liver cancer happens.
Sir, any particular risk factors or clinical signs that cause liver cancer?
Yeah, there are actually a lot of known risk factors from viral infections like hepatitis B and hepatitis C. These infections, if they are untreated and they become chronic, can increase the risk of a person getting liver cancer. Excess consumption of alcohol is definitely implicated in liver cancer. There are certain toxins which are formed by fungi, which if they contaminate grains that we eat, which are not stored properly, they are stored in sort of moist conditions, etc., that facilitates the growth of these mold, which in turn produces these toxins. One in particular called aflatoxin has been implicated clearly in origin of liver cancer. Smoking, as always, is also a culprit in this. So these are like known cancers, known causes. There is also an increasing incidence of something called non-alcoholic fatty liver disease. In fact, a lot of people who routinely do scans, they find that a report saying fatty liver, and there are gradings for this. So the higher the grade and the more chronic it is also a definite risk for liver cancer. These are known causes. Then there are risk factors also. Risk factors would include obesity, somebody being a type 2 diabetic, people who are consuming a lot of processed food, lot of red meat. All these are considered risk factors, not direct causes.
Thank you so much, sir, for explaining causes and risk factors for liver cancer. So, sir, talking about, we have heard that liver, it is an organ that can regenerate. And in liver diseases or liver cancer, symptoms often appear very late. So, when should an individual get into screening or some routine checkup?
Yeah, see, the liver cancer can range from being totally asymptomatic to producing symptoms either because the disease is advancing or because the disease is in a particular location in the liver which produces symptoms earlier. There are non-specific symptoms like unexplained loss of weight, unexplained tiredness all the time. These are non-specific. Specific symptoms which could point to the liver are abdominal pain, abdominal distension, and in more advanced stages, maybe jaundice with passage of yellow urine, yellow eyes, appearance of yellow eyes, white colored stools, and even more advanced stage, it could be generalized itching of the skin, easy bruising. These would be the symptoms and signs that you could see in liver cancer.
So, sir, as we have talked about basis of liver cancer, can you highlight some diagnostic test or diagnostic facilities, some scans that are available for liver cancer?
Yes, there are a number of diagnostic methods for cancer, but as always, the ultimate proof would be from a biopsy. But before we get to that stage, there
Hmm.
is a protein called alpha fetoprotein which can be detected in the blood. This can be elevated, of course, in non-cancerous liver conditions, but usually to a modest level. The normal level being around 4, maybe up to 10 to 20 in other conditions. But when it is increased into the tone of hundreds and so on, it is almost always liver cancer. Very rarely it could be to some other cancer called germ cell cancer, but almost always it points to liver cancer. When it comes to imaging, it ranges from an ultrasound to CT scan to a PET CT scan and so on. All of these have increased sensitivity to identify disease, and liver cancer, it should be remembered, can be unifocal, meaning in one site in the liver. It could be multifocal, it could be in multiple sites in the liver. So once we have a clinical suspicion of liver cancer, like I said earlier, one has to do a biopsy. But sometimes the biopsy is not feasible with the right radiologic appearance, with the increased elevation in alpha fetoprotein. One could almost always conclude it is liver cancer.
Correct. Thank you so much, Dr. Raja, for highlighting, various kinds of diagnostic methods that are there nowadays for cancer or particularly liver cancer, sir. So, sir, as a medical oncologist, how would you say that with new medical advancements and new technologies and therapies are there for transforming treatment of liver cancer?
Yeah, the treatment of liver cancer actually has improved vastly in the last 10 to
Hmm.
15 years. There are basically two or three modalities of treating liver cancer. One is surgery. Whenever surgery is feasible and if it is a localized disease or multiple disease all within a particular part of the liver and patient is otherwise fit for surgery, there are a number of other criteria, liver function, etc., then surgery is a curative procedure. As you mentioned earlier, surgery, the liver is an organ which can regenerate as well as function perfectly well even if you remove, let's say, up to 70% of the liver. So the resection of the liver which is containing the cancer will not affect the liver function. In cases which are confined to the liver where it is not operable or where surgery or the cancer is widespread in the liver and the patient is otherwise fit and well with no other serious medical conditions, another curative option is a liver transplant. So these are the surgical options. Then there are options which are exercised by what we call the interventional radiologists or the X-ray specialists. These again are usually confined to single units of cancer, which are again having certain criteria like size, location, etc. There is something called radio frequency ablation, where you are literally sort of frying the tumor. You pass a probe inside, you heat it, and melt the disease. Then there is another modality called transarterial chemoembolization. Basically, what it is, just like people are familiar with angiogram for the heart, you can do an angiogram for the liver, and you find the blood vessel which is supplying blood to the tumor, and you then inject medicine into that vessel, and you plug that vessel with what you call an embolus. So then the tumor will die. This is yet another method. Then there is something called stereotactic radiation. It's a specialized form of radiation therapy, which can also be used for single or even multiple if they are confined in number. So these are some of the other methods. Then medically, when patient is not suitable for any of these modalities, we have two specific ways of treating liver cancer. One is with tablets called targeted therapy. So these are medicines which will specifically target liver cancer cells and stop signals inside the cancer cell which allow it to grow and which allow it to spread and so on. So that's why they're called targeted therapies. Over the last 15 years, there are at least 4 or 5 drugs which have been tested in clinical trials and proved efficient in controlling liver cancer. Likewise, there is another form of therapy now in vogue called immunotherapy. What immunotherapy does is strengthen patients' immunity, specifically cancer immunity, to fight the disease. In fact, there are medical treatment combinations using both targeted and immunotherapy. So the treatment spectrum for liver cancer is wide and has to be individualized depending on various circumstances, some of them related to the liver, some of them related to other diseases which patient may have, some of them disease related to patient's age, general condition, the kidney function, liver function, and so on. But definitely there are multiple options, and there's no need for somebody to despair because they had liver cancer.
So, sir, I would say that generally we only hear that only when you develop cancer, transplant is the only option. But as you suggested, there are wide treatment modalities nowadays that are available. Thank you so much, sir, for highlighting those. So, sir, we have heard that if cancer has developed in your body, it will reoccur again and again. So, is this true, or like if someone gets treated through liver cancer, so lifestyle modifications or following a good treatment, so that reoccurrence would not occur?
See, first of all, it's a myth to say that a person who gets a cancer will keep getting cancers.
Yeah.
In certain, for example, patients have certain inherited mutations
Hmm.
which will predispose them to possibly more than one cancer, in which case, yes, in their lifetime they may get. There are certain families where certain diseases are passed on, and there it is true. But in the majority of cases, if a cancer is treated for a cure, then it's unlikely that the disease will come back in the future. With regard to preventive methods, like I said earlier, one method is to focus on the diet. Avoid
Hmm.
processed food, avoid or reduce consumption of red meat, avoid high fat foods. Likewise, make sure that the grains are not contaminated with toxic substances, etc. On the other hand, eating of fruits, vegetables, whole grains, those kind of diet supposed to protect the liver. Then obviously avoid bad habits like smoking and drinking, which are
Smoking.
known culprits in causing liver cancer. With regard to hepatitis B, there is a vaccine available which gives full protection against hepatitis B, and therefore in turn will avoid hepatitis B induced cancer. So these are some of the methods which we can do. And then the contributory causes which I mentioned, countries, if they keep the diabetes under control, somebody who is obese, if they can manage to reduce their weight, reduce fatty food consumption, all those will also reduce the risk of getting liver cancer.
Sir, you were mentioning about vaccination, so I have a small question regarding that. That when should a person get hepatitis B vaccination, at some age, and how many doses are there?
Usually the doses are three. One on day one after 1 month, and the third dose after 6 months from the first day. And that will give you usually about 10 years of protection, after which you need booster doses. This can be started from childhood. In theory,
Thank you.
everybody should get it. People who are at high risk, especially people in the medical field, people who are operating ambulances, people working in the emergency field,
Hmm.
fire workers, people who deal with accidents, they are at much higher risk. But the entire population can avail this to avoid this risk, because hepatitis B by itself is a serious infection, even if it doesn't lead to cancer.
Thank you so much, sir. I hope audience is also aware about such vaccination that is available to protect ourselves from liver infections. So, sir, festival season is coming up, and we during festivities, during Diwali, we especially tend to eat a lot of rich food and alcohol consumption. So, what practical lifestyle choices we should make to protect our liver?
See, the problem with the current uh, society is that eating has been made into an act of enjoyment. See,
Yeah.
the fundamental truth is eating is for survival and good health. If you look at all other species other than humans, they eat only for survival. They eat what they are supposed to eat. They will eat at the time they should eat, and they will eat the amount that is required. But we who are supposedly much more intelligent do not do any of these things. We have changed eating into an entertainment issue where we look at the taste, we look at the appearance, we look at the flavor, we look at the color, and so on, rather than looking at its nutritional content, looking at its potential harm, looking at its benefit in terms of preserving health. See, once we have this correct mindset, everything else will fall into place. If we don't have this, we'll always fall into the trap of consuming things which are not only not useful for us, but which are potentially harmful not only for liver cancer but for a variety of other cancers, other diseases. So, a festival when it comes, yes, by all means celebrate, but need not be focused only on eating. A celebration should be about spending time with your loved ones, with your friends, with your neighbors, maybe doing activities which you all enjoy together, or playing games which you all enjoy together. There are a million ways you can celebrate a lot of events, whether it's a birthday or a festival or anything. It should not be centered around eating. So, this is the fundamental thing. People should change their mindset about why we eat, not
Hmm.
for enjoyment per se, but for good health. And in today's world, even healthy food actually can be made enjoyable. There are any number of recipes and variations available which make even the traditionally disliked or unpopular foods actually tasty. People are not even willing to try it.
Correct. I agree, sir. I think making small, healthy choices can help us improve our health even during festive seasons. So, sir, before moving into our next segment, I would like to ask that we have heard that coffee is also very good for liver health. So, can you throw some light on that?
Coffee is actually beneficial for a number of things. It actually reduces risk of gallbladder cancer, for example. It
Hmm.
will delay or prevent Alzheimer's disease. So it has got a number of benefits as long as it's not drunk in consumption and like everything else. You know, anybody takes anything too much, then even a good thing can become a harmful thing. So, apart from a few heart conditions where people have fast rhythm problems, etc., by and large, coffee is considered beneficial for health.
Correct. Thank you. Thank you so much, sir, for answering that. So, sir, moving into our next segment, it would be a myth versus fact segment, sir, where we'll address a couple of common myths that are about liver health. So, sir, first is that many people believe that liver disease is always fatal. So, is this true?
Always fatal, did you say?
Fatal, fatal. Yeah.
Well, if any disease which is allowed to go unchecked can, yes, in
Hmm.
theory, become fatal. Not only liver cancer, even if you have, let us say, something called cirrhosis, which is a chronic damaging condition of the liver, it can eventually lead to liver failure. The fact is, nobody can live without a liver. But again, today's world, there are options like liver transplant, etc., in selected patients. So it's not a universal truth that it has to be always fatal. So it depends on the individual's condition. And the prudent thing to do is to prevent or seek early and correct treatment when events happen rather than let things go.
Thank you, sir. So, sir, moving on to our next notion that nowadays people often tend to have some detox drinks, and we think that this can reverse liver damage.
See, there is no scientific evidence
Hmm.
that these things will actually benefit you in the long term. It is possible in the short term that they give you a lot of feel good factor. It is like, for example, the traditional way of purging your stools, for example. This used to be the traditional way to detoxify yourself instead of the current detoxifying agents used. See, the liver itself, basically, among its various functions, is a detoxifying organ. That's one of its primary functions. It gets rid of a lot of poisonous things from your blood circulation. Medicines which you take are broken down and got rid of from your body. So by itself, it's a detoxifying uh, organ as long as you keep it healthy enough, or at least enough of it healthy enough.
Thank you so much, sir, for clarifying these myths. So, sir, moving towards end of our segment, as we are having Liver Cancer Awareness Month in October. So, any practical tip or some golden rule that we should follow for our good liver health?
Number one, be health aware. Don't take health for granted or be complacent that it will not happen to you. Second, be disciplined in your eating habits.
Thank you so much, sir, for giving such practical tips. And I hope audience will definitely follow this, and as well as I will also follow them for better liver health.
Thank you for this opportunity because it is through media like you that proper
Yep.
information reaches multiple people. Thank you very much.
Thank you so much, Dr. Rajan.
Bye bye.